Hi, my name is Paul Figueroa, and now I'm going to show you guys how to don and doff PPE. Today we have the gown, we have the mask, and we have the gloves. So normally you would don this type of personal protective equipment when you suspect that you're going to be splashed by body fluids, mucous membranes, blood, or anything like that, or if the person is immunosuppressed, or where they need to have for like prevention of infection and stuff like that. So the first thing that we're gonna do is hand hygiene. So you can either do this by washing your hands or using a antimicrobial rub. So like described in the previous video, we apply a mount and then you cover all the surfaces that you cover the same thing as a hand washing, and we have to do this for at least 15 seconds or until the substance is completely evaporated. So you use circular motion and firm motion to get it. And so now my hands are dry. First thing we're gonna do is we're gonna put on the gown. So open it up. Okay. Now you're gonna go through your sleeves first. Okay. Right. Now the next thing we're gonna do is you're gonna tie it. Now the bottom ones you can either tie it to the front if you want or to the back, and then you have to tie your neckties. This moment my neckties are broken, so make sure that you tie this snugly and make sure that you're all covered up. But in this circumstance, my gown is broken, so just make sure that you tie the necktie firmly. So I'm gonna tie mine on the back. Okay. So the gown is always the first thing that you need to put on. Okay, and like I said, make sure everything is covered in front. Alright, the next thing that we're gonna put on is your mask. Okay, now the mask most of it is gonna be tied. So if it's a tied mask, you put the top one first, and then you make sure that your mouth and nose is covered firmly, and then you tie the bottom one. Right now I have these kinds of masks, so I'm gonna put it on. And like I said, you have to cover your whole mouth and chin and make sure that it's snug. So you can pinch this little part to cover the nose and make sure that it's snug. Alright. Next thing you would put on is your goggles if you needed to, but right now I don't have any. The last thing we're gonna put on is the gloves. Okay, so we're gonna take it one at a time. Now these you have to make sure that the gloves are over the cuff of the gown. Okay. Do it on the other side. Alright. And we do all of this to prevent cross-contamination, either from the patient that you're about to do the procedure on to the next one, or the previous one to your current patient. So now that I'm all donned up, ready to do the procedure. Okay, now I'm going to teach you guys how to take it off, or doff PPE. So the first thing we need to do, if your tie is on the front, then you untie it first. Okay, but don't remove the gown. You untie it first. Since mine is in the back, I'm gonna take off the gloves first. We have to treat this whole front area, the outside, as contaminated. So you just did your procedure, you might have some body fluids and stuff like that. Even if you don't see any, you have to treat it as if it's contaminated. So like I said, the first thing we're gonna take off is your gloves. So you can either do this by pinching this part, the outside, and taking it off one hand and making sure that you put it like this, and then you take this ungloved and you go underneath like so. Then you take it off and invert the glove, making sure that you don't have contact with the outside of the other glove, and you throw it away at an appropriate receptacle. So the next thing that you would take off is your goggles if you have any. Right now I don't. Okay, so after that, then you have to take off your gown. So you can do this by untying the back. Now my hands are ungloved, so you can touch the back because it should be fairly clean compared to the front. Alright, now untie the back and untie your necktie. At this point mine is broken, so it's already untied. Alright, so right now you have to remember this whole part is contaminated, so make sure you don't touch. And what you can do is you can wiggle them down like so, right? Then when you can grab the top part like from the inside only, and then you can take it off like that. Alright, then once you do that, you roll it inside out, like so, roll it inside out and throw it away at a appropriate receptacle. And the last thing that we're gonna take off is our mask, and making sure that just this, usually you could untie it and then throw it away without touching the outside, because like I said, this part could be contaminated. So mine is these kinds of masks, so I'm gonna take off from the ear and throw it away at an appropriate receptacle. And that is how you don and doff a PPE.